I mean, I think that anti-intellectualism is the much larger issue.
True.
That is obviously much more prevalent on the right. But there is a related, I don't know if I'd call it an issue per se on the left, maybe more of a pet peeve.
Mm-hmm.
But something that I've noticed a lot in like some of these debate spaces is, you'll have somebody make a claim and then people, rightfully push back and say, hey, can you substantiate that? Can you provide some evidence?
Yeah.
But there's been this trend that I've seen where they're like, okay, show me a study, show me a peer review article,
Mm-hmm.
like they kind of push for that. And so now you have all of these people, going to PubMed and will say the source is PubMed or the source is the NIH. And it really like belies the fact that you have all of these, it's like kind of a pseudo-intellectualism where you have all these people, like either looking up these peer-reviewed studies themselves or pushing people to, go look up these peer-reviewed studies when they lack the wherewithal to like critically evaluate the studies.
Yeah.
Or to even really like understand what they're looking at. They might like glance through the abstract, draw some, conclusion from that, and then spout it off as though it's this, rock solid fact that's been substantiated by, really good, high quality scientific evidence. But there's a bunch of like shit on PubMed. Yeah. There are a bunch of predatory journals that pump out crap and they're PubMed indexed, and like you can't really trust what they're saying. And these people, like they don't have the capacity to, differentiate the crap from the like good high quality stuff.
100%.
Or to like really parse the studies, like evaluate the methodology. Evaluate whether the claims made in the abstract of the discussion are really substantiated by, the methods and results. And I feel like and again, it's not like as bad or as dangerous as the anti-intellectualism, but I feel like there's a danger itself to people, kind of doing this and then saying things as though they are, like proven fact.
Yeah, I think when people say, like, I have a study, it obviously means that they've seen a headline talking about a study and they've never read the study themselves. And I think that that's kind of like belies the main problem that happens. It's like people aren't like, if you're really interested in a subject, going into a scientific review, which is a review of other literature. It's not, literature itself, novel research itself, but it's like the compendium of all the research, and just seeing the depth of knowledge and seeing how many times it's been investigated and how the different ways it has been. That's like a much better way of kind of like understanding a topic than just a single article. And what happens, and you're exactly right, is that like basically you're saying, you're putting a conspiracy into Google and then you're finding search results and saying that, I'm right. Basically PubMed is kind of like a Google search for PDFs, a ton of exactly, you're right, predatory journals that you can publish anything, like literally anything with zero peer review. So the fact that you can find something on PubMed in and of itself doesn't actually mean anything. And it's really hard for people to understand it. And this is kind of like this is the problem that I have, man, where it's like people with MDs and PhDs now, especially after the pandemic, are grifting, and then now you have people with credentials after their names that are taking advantage of this anti-intellectualism. They are kind of like reinventing themselves, and they're getting traction. They're getting places in the government. So it's like it's hard to, you can't, and it's hard for me to say this to people, but it's true. You can't trust everyone with an MD or PhD after their name just because they have that. You can't trust everything that you find online when it has a DOI number. You just can't. It's just the lies that are being pushed are by these grifters that are trying to sell you products. They have referral links in their profiles. They're trying to sell you vitamin supplements as opposed to vaccines. Like, it's just like, it's crazy, man. It's insane.
Yeah. And like whenever anybody, like rails against college and says like, oh, you don't need to go to college, it's a scam, it's a grift. You know, I did just fine. I started a business with no college education. Look at me now. I'm so successful. And it's like, you know, college isn't just meant to be like a, you know, job training center. Like a huge part of it is to help you like think critically and evaluate evidence and teach you like, you know, research methods and things like that. Like that's why there's like genuine value in something like a liberal arts education. It just makes you like
100%.
a more well-rounded, thoughtful, critically thoughtful person.
Yep. I think that's the main thing. I mean, as a professor for a quarter, you know, teaching 250 people, you know, a lot of it is like administrative stuff, you know, like a lot of, all good. A lot of it is administrative. A lot of it is like how to source and cite and understand what's going on, and how to evaluate a paper, what's going on in a paper, you know, reading a paper in depth. I think that's like the real way to. That's the benefit of an undergrad education, and it also gives you a place to fail productively. I think that's genuinely the number one thing, which, you know, the number one thing that you need to do in order to learn something is to fail. And a lot of times in society, you're not allowed to go down different paths and fail and have like a reset spot where then you can go like and use yourself productively from there. And undergrad kind of allows you to do that. You can go into like different research labs. Like if you're interested in chemistry, you can join a chemistry lab. If you're interested in physics, you can join a physics lab. You know, and if you don't like that, then you can just back out and say, okay, I don't want to do that anymore, and now I want to try something else. So I do think that the main value in an undergrad education is the ability to fail. The problem is that the grading system is so unforgiving that people don't feel that people don't feel that ability to learn in that way through the university system because of the grading. And I think that that's the big moral failure of university. Intensa Sonia, how's it going?
Hello. Hi.
You just asked in chat, what's the relationship between patriotism and vaccines? Yeah, so patriotism is like the idea that you're looking out for your community. You're trying to improve, you know, problems that exist in it, and it's like kind of like a compassionate way to look after one another. And in order to look after people that have that can't be vaccinated because of their age, because of their genetic predisposition, because of medications that they're on. Basically, we are like looking out for one another by being vaccinated and spreading less disease. So I would argue that you're not patriotic if you're spreading disease on purpose and harming other people. So that's why I think that patriotism requires vaccines.
So it's kind of a socialistic argument that you were making. I was wondering why. Because like patriotism for me was like something like nationalism, but okay, I understand better now.
Yeah, nationalism is usually referred to kind of like more of a competitive drive against other nations versus like patriotism is more about like compassion for your countrymen kind of thing.
Okay, I understand now. Okay, so basically it's more like a humanistic vision than. Okay, I understand.
Yeah.
So I understand the humanistic, and sorry, I'm a French Canadian, so my English is not perfect.
All good, thank you.
Sorry if I sound weird.
No, you're totally fine.
Okay, so but what do you think about when vaccines are imposed in a mandatory way and may cause some, I don't know, some distress in some people? I know that this happened maybe more in Canada than in the US, but what do you think about aggressively imposing vaccines?
Yeah, so I don't think that like we should strap people down to a board and vaccinate them, but we should make it required so that there is some like social friction that if you want to be in like social places and you want to be out in public, you should be vaccinated. And I think that they should be mandatory. So I like kind of like the Australian model where they basically give you a huge tax credit at the end of the year if you're vaccinating. I think that that's a good like social pressure. I know in places in Europe, it's like a one-time fee if you're not vaccinated. I actually read a study, and they did, I think it was in France, or they removed the mandatory vaccinations for kiddos, and basically they suggested it, and then vaccine rates dropped like 10%. So I think it does make a difference in order to like make sure that kids are vaccinating. So yeah, I definitely think that it should be mandatory.
Okay, so I do understand that there are quite a number of vaccines that are important and that have changed humanity history. But what did you think about how the COVID-19 vaccination campaign was done? What do you think about it?
Yeah, it went great. I mean, the original vaccine was actually the most like highly efficacious vaccine that's ever been produced, at 95% efficacy when most flu vaccines are only like 60 to 70% on a good year. So it was 95%, and it was incredible. I think that, and it did a great job of eliminating people from losing their life from COVID-19. So, SARS-CoV-2 positive, having SARS-CoV-2 in your body is different than COVID-19, kind of like how HIV and AIDS are two different things. So basically, it prevented people from entering the worst symptoms of COVID-19 and losing their life. So I think worldwide, the studies now are saying about 3 million people lives were saved from vaccines specifically. So yeah, I think it's a good thing.
Where do you get your 95%? And is this percentage still right in front of like the new variants?
So that's a good point. Yeah. So 95, I was talking about the alpha variant, the 95% was from the Moderna and the Pfizer studies. They published those. So yeah, so it's from the FDA.
Yeah, it's not the case anymore, I think. Do you know what it's like the new?
Correct. I think so. That's not going to be 90%, 95% efficacy, just because the new variants spread a lot more easy. But I think I don't know what the latest ones are, but I think that the biggest win for vaccines and why you should still like vaccinate for COVID and flu every year is basically like long COVID is a big thing. Long COVID is a neurological disorder that happens from SARS-CoV-2 infections, and it helps. It doesn't eliminate long COVID exactly, but it actually diminishes the likelihood significantly. So I would definitely say that it's a good thing to still get vaccinated.
So what do you think about the post-COVID-19 vaccination syndrome?
There is none.
Well, I have plenty of studies here in front of me. There are studies here from Wiley, from Frontiers.
Yeah, so basically those are like, most people are going to be vaccinated. So what happens is that they can get post vaccination infections from SARS-CoV-2. So yeah, it's the SARS-CoV-2 vaccination is completely safe and effective, and people should still be getting it.
So these studies are bogus?
I think that like there's a lot of there are some studies trying to bolster and make the spike protein better, but none of those studies are saying, the legitimate ones are saying that vaccinations is not the way to go and nobody should be vaccinated.
I'm not saying that the studies are saying that it's not the way to go. And I'm not implying that because there might be a very low percentage of people that can be affected and injured, which, I mean, it's been validated by science that there are people that can develop syndromes, chronic syndromes after some types of vaccine, and especially the COVID-19 vaccines. I know it's a very, very low percentage.
Yeah, we're talking
so I'm not.
we're talking about like 1 in a million. So it's like super rare, like so in Guillain-Barré's and stuff is super rare.
It depends. I'm not talking about Guillain-Barré. I'm talking about the COVID vaccination. Okay. I'm talking about post-acute COVID-19 vaccination syndrome. I'm talking about the post-COVID-19 vaccination, which is like long vax syndrome.
Yeah, none of that.
Talking about
none of that. I mean, a lot of that is psychosomatic, where people like.
No, it's not.
Yes, it is.
Come on.
Yes,
That
it
is
is.
meant that you saying that for me sounds like medical gaslighting.
Okay, all right, that's fine. I mean, because you can. I talk to people, and every single Republican that comes in here that I'm
not a Republican.
Okay, well, I'm
not a Republican.
That's fine. You threw yourself on that sword.
I'm a socialist.
Okay.
I'm a socialist.
Sure.
I'm a socialist.
Sure.
Okay.
Every single Republican that I come into my chat all have vaccine harms, that they're talking about and stuff. So it's like, what is the the likelihood that all these people are, all have the vaccine harms done to them? It's like 0, right? So what's more likelihood is that people basically after getting vaccinated, they hear all this fear mongering from people, they hear all this hysteria, and they start psychosomatically like getting nervous about it, and they start having panic attacks, and then they present to the emergency room and they have these things. And so it's like, no, I don't think that there are among the 10 billion dosages that have been used in the mRNA lipid nanoparticle like vaccine delivery system, I don't think that there's something systemically wrong. I mean, you do realize that like we are using the same molecular biology delivery vehicle for like personal cancer treatments, right?
Listen, you were talking about something.
Isn't that weird?
No, you were talking
weird?
about mass hysteria.
Isn't it weird that nobody actually talks about that or even knows that mRNA and lipid nanoparticles have been used since 2015, and nobody had like post gene therapy syndrome, in 2015 to 2020, but now all of a sudden, after the disinformation, after the Russian bots, all that nonsense happens. Now all of a sudden, people have this mass hysteria about mRNA and lipid nanoparticles. Don't you think that's a little weird?
Listen, it's a good question, and for me to answer that, I would have to go and look about what you're talking about. Okay,
you should.
And of course, I will. And so this was the first time that this was used in a vaccine across a huge population as well. So I'm not sure if it's comparable, but I will go and look at it.
Yeah, it's been used. It is the standard of care for molecular biology in order to deliver mRNA and lipid nanoparticles. Basically, you're either going to, if you present to with cancer at an early enough stage, you're basically going to get an adeno-associated virus, an AAV, which is a viral particle that's been evolved to basically deliver gene therapy treatments, or you're going to get an mRNA lipid nanoparticle. So, those are still the standard, and we still use those, constantly. But it's obvious to me that this is just like some kind of like anti-COVID, vaccine misinformation stuff that's happening, and you don't see a big one that people talk about is like myocarditis. And even myocarditis rates, which is the Myocarditis Foundation in the United States, says that 700% more cases of myocarditis with COVID-19 from natural COVID-19 than the vaccine itself. So it's just hysteria.
So there have been like several studies about the link between long COVID and post-vax syndrome. Okay, so it's not only one study.
No, because people that have not been vaccinated have long COVID, so it doesn't make any sense. How can a piece of mRNA inside of your body replicate indefinitely?
listen, there are people that are not vaccinated.
Tell me. How does that happen? How does a piece of mRNA indefinitely create mRNA from mRNA?
Well, actually, that is being under study right now, and I've seen things, and I didn't memorize everything right now.
It doesn't exist. mRNA, you can't create more mRNA. No, you can't. You can't make no. I can tell you, as a molecular biologist, this is my field. You can't make mRNA from mRNA. You don't get to. You don't. It doesn't make any sense. There's no mechanism for that. Like the reason why people use mRNA
is not necessarily the mechanism under the syndrome. You don't know about it.
Have you read
the study?
So long COVID.
Have you read the study?
Long COVID is is where SARS-CoV-2 will infest an organ, okay, and it'll evade detection mechanisms, for example, because it infests that organ system, and it'll create SARS-CoV-2 inside your body and indefinitely just spew out spike proteins and viral particles from that organ. So for guys, guess what? Your testes could actually get infested with SARS-CoV-2. That's actually a really common place for SARS-CoV-2 to lie dormant and create it. So again, like, how would you have an indefinite production of spike protein that happens from an mRNA particle?
Well, this is not necessarily the mechanism happening after the vaccination necessarily.
How would it work then?
Well, there are studies. Do you want me to read you the study?
What would be the mechanism? How explain it to me? You don't need to read a study that you don't understand. Okay. You can just explain to me the mechanism.
It's a good question. You know what I'm going to do? I like discussing with you because you're asking good questions. So what I'm going to do is I'm going to read the studies and try to understand how I can understand, and then I will come back with you and argue with what I understand. And if I'm wrong, and I want to learn how to argue about this. Is that okay?
That's fine. No, I'm totally okay with like people asking questions and people like saying that. I mean, I would love
respectfully. I want to understand. Okay, I just want you to know that I'm not against vaccine at all.
Okay.
I just know that there are people that have developed some syndromes, and you can, of course, say that it's mass hysteria, but this is not what I believe. I've read studies that I don't remember all the details, but I can go back, try to understand them better so that I can memorize what it's really about, and I will come back and ask you questions.
I'll do you better. You can join the Discord, and you can link your studies there, and we can talk about it, and go ahead. Like I totally invite you. I'm not like there are genuine problems with the pseudouridine, basically, that was put into some of the uracil inside of there was basically swapped for pseudouridine in order to try to make it a little bit more, so that it wouldn't degrade as quickly, So like people have like questions on like how to improve the pseudouridine, the molecular biology of that. You know what I mean? And the problem is that like people have taken that with like, people that are vaccinologists, that are molecular biologists, that are trying in good faith to try to make the best possible vaccine, have basically taken that and said, no, this is actually showing that all these vaccines are actually poisonous. So that's why I feel like there is a lot of like bad faith like questions like for this. But I'm not saying that you are. I'm not just saying that you are, but I'm saying that other people have taken this road, and that's why I feel like as a scientist, I have to say like this is what the conclusion is. We can talk about these edge cases and try to how to improve vaccines, but the conclusion is still vaccines are safe and effective, and we shouldn't if you're healthy, you shouldn't worry about these types of things.
Okay, so what if you're unhealthy? Because I'm coaching people from a community that are not healthy to start with, and you can of course take the argument that they're hysterical, or they're imagining things, or they're maybe like I don't know, you can say they're paranoid or whatever you want to say, that it's mental. but I've had many testimonials of people talking about issues post this vaccine. And I'm not saying this is all vaccines. I'm not putting all vaccines on the same level, okay? I really agree that vaccines have saved humanity and many kids and many humans. And if tomorrow I get bit by a dog or I put my foot on a rusty nail, I will run to get a tetanus vaccine. So you get me?
Mm-hmm.
I'm not an anti-vax. Some people are accusing me of being that way, but this is not who I am. I was just wondering, because I've had so many testimonials. Of course, it's inside a very niche community of people already suffering from chronic fatigue syndrome, ME, which is myalgic encephalomyelitis, and several chronic or autoimmune diseases to start with. And they've noticed sometimes it's mild aggravation, sometimes it's pretty severe and really impairing and debilitating. So, of course, you can say it's subjective, but I listen. So, and then I find these studies, and I do not have all the notions in mind, but I was wondering, how should people that are maybe have an impression of them being immunosuppressed or ill, but yet it is not necessarily all recognized yet by science, how do these people should behave?
I mean, it has been studied by science. It's been recognized, and the vaccines are safe and effective for COVID.
I'm talking about illnesses like
I know, and I'm telling you. So I'm telling you that a lot of times, if someone has like a disease where they can't take a live attenuated vaccine, for example, then that is usually the mechanism where your physician will say, okay, you should avoid live attenuated vaccines. But in that case, guess what? The mRNA lipid nanoparticle vaccines aren't live attenuated, so they're actually safe. So again, like, I would be wary of any physician that is telling people that, like, you should avoid these things, that there's no benefit to it, because that physician obviously doesn't understand what public health is. They don't understand virology. They don't understand viral evolution. They don't understand pandemics. They don't understand community spread. There's a huge host of problems, not taking that seriously. And I think that those physicians are doing harm, genuinely. People that are,
but you know how things are researched, right? Like that when we do research, I'm not the one doing it, of course, but like the principles of shrinkage, how some results are removed from like the final conclusions because there's too much discrepancy between the results.
who do you think does who does the research on these? How are the studies done?
Well, you explain to me. You know more than me.
I mean, I can tell you what it is.
I'm just talking about the concept of shrinkage.
Okay, so it's incorrectly thought that Pfizer and like Moderna are doing their own tests. Basically, during the FDA trials.
I'm not saying that they are. These studies are done in labs that are usually in universities or research centers.
Yeah, exactly.
I'm not saying that they're affiliated. That's not
exactly.
what I'm saying.
I know, and exactly, and that's the point is that so then what would the incentive be for these research universities in order to hide results? If they're
I'm not saying
connected
they're
to
hiding results. This is not what I'm saying. What I'm saying is that in order for these studies to be efficient, I mean, if you study all the individual biology of all the people that have, some different results or some different presentation, it's a known fact that shrinkage is used as a concept in studies, in all studies. It's a known fact. It is used.
What do you mean by shrinkage? What are you talking about?
Well, there are results, or there are results that are like too far apart from a certain. Oh, I lost you.
You're good. You're good. I'm here. I'm here. Go ahead. Keep on.
Oh,
I'd fix something.
I don't have the right words. I'm saying, okay.
I mean, so basically, but the
there's
point,
a me.
if it's not studied, okay. But the thing is that let's say there is a nefarious. Oh, thank you for the crown thing. Thank you, Evil. Let's say that there's a nefarious scientist. Okay, the worst possible outcome that could happen: a nefarious scientist that wants to, push an ideology and doesn't care about scientific scrutiny and wants to push a narrative. Okay, but like that doesn't happen like in a vacuum. There are other studies, there are other scientists, there are other countries that are all looking at this. So like, for example, like Denmark, this is a big thing that people talk about with pharmaceutical companies and the scrupulous nature of capitalism in healthcare, which I'm a complete critic of, and I don't agree with it at all. But the fact of the matter is that like the vaccines that were developed in universities and research institutions, then they get licensed out by these pharmaceutical companies because they don't, like, universities don't have the capability in order to biomanufacture like all these vaccines. So that's why these, vaccines get bought by the licenses get bought by the Pfizers and Modernas of the world. So like, the point is that other research institutions are doing their due diligence in order to check and make sure that like that is what it is. And there is some, there is some competition that happens between like Moderna and Pfizer, for example. So like the idea of like Moderna having, all these secret ingredients inside of their vaccines. And it's like, well, who the number one opponent of that would be? The number one person, number one group that would like call BS on Moderna having like graphene sheets in their vaccines.
This is not what I'm talking about. This is not what I'm talking about. I agree with what you're saying. That part, I understand that.
Okay.
I don't think, overall, of course, if there weren't like serious studies behind this, and there wouldn't be a real efficiency behind this, of course it wouldn't work. I understand that. I'm talking about shrinkage in medical studies, So I'm just going to read it here because I'm not as good as what I can read.
Okay.
So shrinkage in medical studies refers to a statistical phenomenon where extreme estimated effects like treatment benefits or risk factor associations are pulled towards a more moderate or average value. Okay? So basically, by removing these extreme effects, people that might have some really bad effects in studies those results are removed from the final conclusions, even though I know that studies will still mention that there is this methodology employed into studies, right?
So do you think that outliers should be included on studies?
But I'm not saying that for a study that wants to evaluate medium efficiency, they should include the outliers. But just the fact that you call them outliers, it's kind of a little bit dehumanizing, though.
No, it's not.
It's like
it's because this is actually the exact reason why I don't work with humans as a scientist. Humans are really bad science subjects. They're really bad. They don't show up to all the all their treatments. They have the things happen. They stop showing up into these studies.
Not necessarily. This is not only about people not showing up. This is also people having different conditions or different biological individuality, different genetics, different illnesses to start with.
So
are you saying that these people should be marginalized to a point where we shouldn't study about them and we just call them outliers and they don't matter? And so if something happens to them, they're just like collateral damage and they don't really
you're
matter?
misinterpreting what an outlier is largely.
I don't know. I want you to explain to me what it means.
Yep, I'd love to. So I do a lot of human-centric research. I do research in orthopedics. A lot of orthopedic research is clinical research. And you have to be very delicate with your treatment of outliers, because if somebody really did have, like a genuinely poor outcome, that's something that you want to include, because you want to make sure that you do capture those people, right? So outliers aren't routinely removed if it's just like, oh, this person is, two standard deviations below the mean. You have to kind of investigate that further. Is this, somebody who legitimately did very poorly, or is there some sort of, other anomaly going on here that would really kind of nullify these results, and rather than kind of be a truer representation of the data, it really kind of skews the data and detracts from the truthfulness and the validity of the data. So for example, there are a lot of like scoring measures that are used in orthopedics, and some of them can be pretty unintuitive to fill out. An example of which is something called the IHOT. It's the International Hip Outcome Tool. And, for everything on the IHOT, what you would kind of anticipate the sort of good response to be and the bad response to be, it's inverted for all of them. And so there are countless people who fill out the IHOT and they accidentally do it in reverse, where like a 100 would be no pain and a 0 would be maximum pain. Things like that, because that's how they wanted to configure it, so that 100 be a really good score and 0 would be a really bad score. But it's unintuitive and it's dissimilar to the rest of the kind of measures that we use. And so people would routinely fill it out incorrectly. And so you'd have all of these individuals where all of their other scores are, a 90, 90, 90, 100, and their IHOT is like a 10. And then you have to say, okay, what are the chances that they did horribly on the IHOT when the IHOT asks very similar questions to all of these other measures, but really, really well on these other measures? Or, this IHOT score is anomalous. It's not a true representation of, kind of their hip pain and function. And so in those cases, you might remove those outliers so that you have a truer representation of your data, because you can look at that patient and understand that it's an anomalous score. It's not real. And so like that, the kind of thing that if you're being responsible with your data, you would do in terms of like removing outliers, because you want to make sure that your data best represents, kind of the real average among your patients.
Yes, the thing is, a person is not an average. I understand what you're saying, and I understand why this is done. I'm not saying it's not logical. It's absolutely logical that studies work this way. The problem is that the outliers, or call it as you may, are still marginalized in studies, because if you remove them from the general result, then their own reactivity, sensitivity, or response to whatever pharmaceutical, vaccine, whatever it is, remedy, call it whatever you may, it can be anything. It's not just vaccine.
No, so I'm saying you don't routinely remove people just because they did poorly. You remove people if their responses are anomalous, because like the pattern doesn't fit, right? That's an example. The one that I just gave you is an example of, for that particular measure, the pattern not fitting.
Good.
So it's clear that score isn't a good representation. But if somebody, did poorly across the board, everybody else is reporting, hundreds in all their scores, and then one person just reported 10 across the board, then it's like, oh, damn, that person did poorly. You're not going to remove that outlier.
No, it does. Well, okay, so that's fair. That's a fair argument. So you don't remove it, but then still, there's going to be an average that's going to go towards, the positive results, right? And so you're going to think that, okay, despite this person responding really poorly, you're going to say, as an average, this medication is good, is positive, so it's efficient. Let's put it out there, right? Which is fine, which is very logical nonetheless, right?
That's how statistics work, yeah.
Yes, but then in the world, like in the real world, there are going to be maybe some people that are going to react really badly to this.
Yep.
Yeah, and not necessarily all of them will be, how can you say this, noticed in advance for this. Not everybody might know what it is that might cause the issue, especially if studies don't point out exactly who should be worried about this, right?
So, I mean, there's a huge echo now.
Oh, can you hear me?
I can hear you, but I can also hear myself.
So,
But
so
like,
if these,
kind
if
of
these
just,
people,
well,
it's okay. Oh,
yeah. I mean, like, I want to respond to that. Like,
okay.
I mean, yeah, like that's just how life works, you
I
know. Like,
understand, but
if you
like
have
I
something that,
understand.
well, no, because no, like let's work with the counterfactual for a second. So let's say, you know, you have this group of 100 people, and 95 are really benefited by a particular drug, and 5 do poorly. Right,
Yeah.
5 have some, you know, adverse effect. One, you're going to report that. Like, you're going to report the number of people who have complications. Right, in orthopedics, you report the complication rate, something that's routinely reported. You report the, you know, the reoperation rate. You report the revision rate. You report the people who did poorly as well, even if, you know, the majority do well. So, like, it's not like you're ignoring these people, but if you're reporting like kind of the aggregate result of this, you know, of a given procedure or something like that, or a given drug, you know, you need to know how it's going to affect, you know, kind of the population writ large. And you still want to make sure that people are aware of people who, you know, have adverse outcomes and do poorly, or have some sort of, you know, side effect. But that doesn't detract from the fact that if you're giving this to, instead of 100 people, 1,000,000 people, well, you know, 950,000 are going to really benefit from it. And so if we're operating with the counterfactual for a second, and you say, okay, well, out of that 100, 5 people did poorly, and so we shouldn't give this drug out to people because those 5 people did poorly, and, you know, we want to at all costs avoid people being, you know, adversely affected by this drug. Well, then what you've done is you've deprived those 95 people of the potential benefit of the drug. So, like, you're giving out some hypertension medication, some blood pressure medication, right? And you have 5% of people who, you know, do poorly and they have an adverse effect, but you've got 95% who are really benefited. You know, it brings down their blood pressure 20 systolic, like 20 points systolic. And so, like, that's going to save them from heart attacks and strokes and those kinds of things down the line. So, you know, you're potentially avoiding hundreds of thousands of strokes and heart attacks and premature, you know, unaliving by giving this drug to people. But you don't do it because 5% of people, you know, have you know, have an anaphylactic reaction or something like that. So, like, if you're looking at it in the reverse, you're not giving this drug because you're scared of those people having a bad reaction. Well, now you've condemned the people who would have benefited
This is
to
not
the
my
strokes and the heart attacks.
Oh my God. Okay, this is not my purpose. My purpose is actually not to scare. My purpose is to know exactly why some people might be vulnerable to some drugs or some you know, pharmacological remedy or vaccines. You know, my goal is to make sure that science is really looking at, you know, the small subgroups of people that might react really negatively, and knowing maybe why, so that these cases may be preventable in the future. Because if we know and these cases are controlled, I think it's going to be beneficial for everybody. What I mean by that is that I agree that vaccines are, for a majority of people, beneficial. The thing is that even if it's 1%, and I know it's even less than that, so this is not me saying it's 1%, but let's just keep it simple. Even if it's like a person in 1,000 or in 1,000,000, but the person that is hurt is really hurt, and it represents her whole life. And even if it's a minority, she still has a right to live and to have, you know, to enjoy life, right? So what if we knew enough about these individualities to prevent these effects, instead of constantly opposing the majority as being, oh, look, the majority is well, so it's not that bad because, it's just a small percentage. But these are people we're talking about. It's people, and it's their entire life. When it's hurt, it's hurt. And I've seen people, I know it's a minority, I know, but I've seen people having their lives completely, torn down by things like this. And it's a minority, again. And I don't see that it's an hysterical response. I don't see that it's paranoia. There are symptoms involved. You can judge that it's mental as much as you want, but I listen, and I've read many testimonials. So I'm just trying to understand, how can this be preventable, and not to oppose the majority to the minority, even if it's very little.
You're what this is showing that you just didn't really look into it. So I just looked up what populations were negatively affected by the COVID vaccine, right? Second search result is from the Canadian government. Adverse event following immunization reports by age and sex. Age differences. The rate of adverse events reported was highest among the 40 to 49 year age group, followed by those in the 30 to 39 year age group. The rate of adverse event reports was lowest in the 5 to 11 year age group. Sex differences. Overall, most adverse event reports were from females. The reporting rate for females was 75.9 reports per 100,000 doses administered, compared to 31.5 per 100,000 doses administered for males. So they do these studies, and the fact that you think that they're not looking into this and they're not looking into the populations at risk,
not looking into this,
just means that you're not looking for that data.
Well, I did find studies that corroborate the syndromes that I've encountered in some people. And I was talking about let me find it. The post-COVID-19 vaccination syndrome, and that it creates actually even something called CIRS that is usually associated with...
what is that?
It's chronic inflammatory response syndrome.
Okay.
I honestly, I just want to reiterate that I am pro-vaccine. I just want to make sure that some people that are vulnerable have help, because...
Okay, so based on your in-depth research, what populations are vulnerable?
Well...
Teach us. It sounds like you're an expert on this.
Oh my God, this is kind of mansplaining. I don't like this. I just want to know.
Mansplaining? I didn't explain anything. I asked you to teach us.
I don't want to teach you. This is not what I want to do. I want to understand how it works.
I have a 65% female audience, so it's actually you're talking to women here, so it's all good.
Okay. So I've met a lot of people in the community that suffers from ME/CFS, which is myalgic encephalomyelitis, and chronic fatigue syndrome, that have been actually, most of them have been exposed to moldy environments for a variable period of time, and most of them also have Lyme disease to start with. So you're going to say, oh, well, maybe it's just the disease that is already there that is the problem. And I might, it's logical. But I've heard a lot of people talk about severe aggravation. Sometimes it's just mild, sometimes it's moderate, sometimes it's severe aggravation after the vaccine. Okay, so I just want to understand what is happening to them.
Hey, Sonia. I wanted to come up and just address something that perhaps that you might not be aware of, but it could absolutely explain some of what you were maybe seeing in real world. So we know that the SARS-CoV-2 virus, that's the virus responsible for a COVID-19 infection, we know that up to 60% of cases can have no symptoms. So the immune system is what generates symptoms. And this virus is really good at kind of bypassing it early on in the early stages of infection. So often, I think what we are seeing is individuals are aware that they're getting vaccinated, but they are unaware that they are getting infected. And then they present with long COVID symptoms, but they're blaming it on the vaccine that they were aware of receiving rather than an infection that they were not aware of having.
I find it too convenient. I understand that,
It's a pandemic.
it's probably,
What are you talking about? It's a pandemic.
I know.
That's a
Wait.
pandemic that's in community
Okay,
spread
so
still.
please-
So the idea
please
of
don't
like
scream.
it's convenient that it's
Please-
around. That's the whole reason.
Please
It's a
don't
pandemic.
scream. Please don't scream. Please don't scream. I'm not screaming. I'm very calm. I understand that maybe some cases could be explained by that, but I have difficulty thinking that it's that, because some symptoms are really all over the top, like they're so over the top and not at all presenting as symptoms of COVID-19, actually.
That's because
Okay?
COVID, so when we refer to COVID-19, that is the respiratory infection. Okay. But the virus binds to what's called our ACE2 receptors, and those receptors line all of our blood vessels, and our blood vessels are everywhere in our body. I mean, everywhere. So often it is able to go into the lungs, and maybe you will not have symptoms early in the infection because of how it's able to kind of bypass the immune system early on, but then travel a little bit deeper into the body and into the brain. We see that it can persist in the brain for up to 8 months, they've seen. In the gut, the GI tract, they've seen, I think, 4 years. They have evidence of that. Even the new variant that's circulating currently, the BA.3.2, the cicada that's currently getting a little bit of news, that stemmed from a BA.3 infection that was chronic, that somebody had received. They got infected in early 2022, remained infected that entire time, and then were able to transmit it again in, I want to say, late 2025, and now it's starting to circulate. So it's able to stay and really affect all the organ systems in our body. So I know that we often think of COVID-19 as a respiratory disease, but it really impacts the entire body.
I understand that this is like the phenomenon of long COVID, and I know that it could go very far. It affects organs. It can create like all sorts of syndromes, inflammation. I know it can stay in the gut. I also know it can also impair mitochondrial function. I know because I've had to go through a lot of this, and so I know about this. I'm talking about people that were in remission, they were doing well, and it was just on the day of the vaccine or the day after, their life completely turned around and never got better even after years. I'm talking about this. So was it an infection, a concomitant infection that happened coincidentally? Maybe in some cases. I'm not sure that it would be scientific to presuppose that it's the case in all cases either, without studies, right?
We do have a lot of studies though on it, and we know that long COVID can present in really any variety, whether you have a severe COVID-19
Yes, I
infection
know that.
or
I know that. I
asymptomatic.
just said that I believe that, and I've
Okay.
gone through it myself, and I've seen it in others as well. I'm not talking about that.
Sorry, my son entered the room. No, and I get what you're saying with that. But something else that is, as I stated earlier, the immune system is what generates a lot of symptoms often. And this virus is good at exhausting what's called our T cells. So they kind of stop fighting for a little bit. And then sometimes when an individual would get vaccinated, it would bump up that immune response again so that it is reacting to an already present virus. It is the virus that is causing the issue, not the vaccine.
Okay, so you're saying that, are you saying necessarily the virus of the COVID itself, or could it be like the activation of a previous, the presence of EBV, which is something that has been also studied in the case of long COVID?
We have seen a lot of activation with reactivation of Epstein-Barr virus, as well as herpes simplex, a number of viruses, because as I stated earlier, this virus exhausts what's specifically are CD8 T cells, CD8 positive T cells. And those are the cells that are responsible for killing or controlling cells that have been compromised, whether that be cancer cells or virally infected cells like EBV infected cells. So if those cells become exhausted, what's going to happen? We'll see EBV reactivate. And we're seeing that across the board. We're also seeing shingles, the cases of shingles are rising.
I agree. I've seen that as well. And not only that, maybe other types of microbes can be involved as well, right?
Well, that goes into a bit of a different branch of the immune system, but specifically with viruses infect cells. And so the T cells are the ones that are responsible for controlling our own self cells.
Okay, so, that's good. Thank you for explaining that.
If I can just mention a couple things. So it sounds like a lot of what you were talking about with regard to this post-vaccination syndrome, you can correct me if I'm wrong, but I would bet that a lot of it, comes from this Breaking the Silence Recognizing Post-Vaccination Syndrome article published last year.
I've actually found many more than just that one. So, but not many more, but there are quite a few that I found about it.
Yeah. So this actually goes back to a point that I was talking about with Dr. Greg earlier about people who are looking at studies and citing studies who may not have, a scientific background and, the kind of experience to discern what may be legitimate from what may not be. So looking at this Breaking the Silence article, they compare this post-vaccination syndrome to this, myalgic encephalomyelopathy or encephalomyelitis / chronic fatigue syndrome, POTS, postural orthostatic tachycardia syndrome, small fiber neuropathy, which small fiber neuropathy is definitely real. You can do a biopsy and find small fiber neuropathy. But
I know about that.
And mast cell activation syndrome.
Yes.
So myalgic encephalomyelitis / chronic fatigue syndrome, POTS, mast cell activation syndrome. These are all controversial diagnoses in and of themselves with...
Sorry, can you repeat that, please?
I said these are all controversial diagnoses in and of themselves with genuine debate among the medical community about whether these are, organic illnesses or whether they are somatization, syndromes. Where the symptoms are very real for sure, but they may not have as much of an organic cause as kind of a psychological etiology, right? So it's comparing them to these already very amorphous sort of controversial conditions, and then it tries to get into the pathophysiology, right? It's got this chart where it's citing interleukins, C-reactive protein, these markers of inflammation, EGFR, serum urea, et cetera, et cetera. And I'm looking at the articles that it's citing for the post-COVID vaccination syndrome, right? It cites 3 different articles. One isn't even an article, it's a preprint that's available in Europe PMC, but it doesn't cite the actual article if the article was ever published. And then the 2 other articles that it cites are published in the journal Vaccines, which is an MDPI journal, and MDPI is known to be an incredibly predatory publisher that is willing to publish articles without proper peer review. And this article itself is published in this Helion journal, which, what a bizarre name for a journal. And looking it up, it is also a very high volume journal that has been shown to lack, a very rigorous peer review process. And so when you kind of look at all of that stuff in totality, It sounds like people who are trying to kind of make a name for themselves, push back against the scientific consensus, kind of be sort of, countercurrent, right? And publishing these things in these, relatively disreputable journals, just because they know that that's where they can get it published, right? Not in these larger, more reputable journals. And it's compared to these other conditions that are debatable in and of themselves.
Dude, you know what's so crazy is that this was onto that. This was because Iwasaki did, which is one of the main. She's incredible talking about the best researchers in long COVID, and she put out this preprint. I remember it was February 2025, right? Just as the Trump administration comes in, and everyone's thinking like, dude, why is she doing this? Like, what is the why is she going into this like COVID vaccination BS when she's such a like a credible researcher? You know what I mean? And she, as soon as she does this, she gets like into these ACIP panels, and she's in the COVID thing. And bro, exactly what you're talking about. Iwasaki, one of the most prominent researchers in the world, that preprint that she got out, never been peer reviewed, never actually released. Like any journal in the world would publish Iwasaki. They would love to, but the fact is that other people in the field are looking at this preprint, the immunological and antigenic signatures associated with the chronic illnesses after COVID-19 vaccination, and are saying, this is all BS. This is all political that you did this, and we don't agree with any of it. And it can't even get published, man. More than a year and 2 months. One of the most preeminent, premier vaccinologists in the world can't get a publication based off of that. Like that should tell you something. That should tell you something.
I remember that paper coming out because one of the critiques, if I recall, was that it wasn't, because our antibodies can wane within anywhere from 3 to 9 months. It wasn't able to account whether or not these individuals ever were infected or not.
Yeah.
So they could be blaming things on vaccine when again it could actually be the virus causing these issues, and likely is.
Yeah, I think
to the debate doctor. Are you aware of the extreme low funding there is for research for MECFS? Are you aware of that?
Yes,
and how unjust it is?
Yes, it is. It is absolutely underfunded research.
So since it's underfunded, how can you know about what's really going on and just dismiss it ahead?
I didn't dismiss it out of hand. I said that it's a controversial condition.
In about 5 minutes. I'm sorry.
It's okay.
But I understand that it's controversial. Okay, I understand. But it's controversial just like many illnesses were controversial in the past. And I know it's an easy argument to make.
No.
But it's a serious one nonetheless.
You're Sonia, you are being played by these Trump Republicans, and they're using. Listen. I know you're not a Republican. Just listen to me. It doesn't matter what you are. I don't care if you're green. It doesn't matter. You're getting played. They're using your compassion. Yes, you are. They're using your compassion against you, and they are using you. And I know. And then you should hate even more that you're getting played by him. You're getting played by the Maha people. You're getting played by the Maha people. You're getting played by the Trump administration on this one. I'm sorry, but you are. You're being
against MAGA, and I am against
then you should be but I'm telling you that you are feeding into their
I don't want to feed it.
You are and they are feigning that this is happening, and you're biting into it.
I'm pro-vaccine.
I know it doesn't matter, but I'm telling you that they are feigning. They're concern trolling basically, and you're falling for it.
I don't care about Maha or MAGA.
Well, you're buying into their articles. You're buying. You're promoting it.
Not.
Yes, you are right now. That's what this is. That's what this is.
No,
it is.
No, they don't have arguments most of the time.
Yes, they are.
They don't have arguments.
They're trying to push this whole nonsense. This post-COVID-19 vaccine syndrome. They are.
This is no.
Yes,
I don't agree
yes,
with
they
that.
are. They're pushing this because they're anti-vaccine and they're trying to sow discord within the vaccine research community, and they're trying to push this stuff.
In
This is
addition to
not
downplaying
why I'm
COVID.
doing this.
Yeah, exactly. That's
You're
what's actually
labeling
happening.
me.
I'm not reaching at all. I'm telling you exactly what's happening.
You are labeling me just because you don't have
I'm not
the answer
labeling
to
you
my
anything.
question.
I'm not labeling you at all. I
No,
don't care what you label
no,
yourself as. I'm telling you that you're being played. That's what it is.
I'm not. Well, that is very condescending of you to say that to
I'm
me.
giving you tough love. I'm telling you what it is. I'm sorry
Well,
that I don't. I'm sorry that you're offended, but that's just what it is. I'm telling
so
you the
what
truth.
about? Okay, so well, I could talk about how McKinsey and Moderna and Pfizer are connected. What is your response to that? You
What are you
think it's
talking about?
about me
Through
being?
pharmaceutical companies? The what?
Do you know that McKinsey? You know that Moderna and Pfizer are McKinsey clients? Go and
McKinsey,
look it
like
up.
the
What are you talking
consulting
about?
firm?
Look it up. Okay.
Wait, are you talking about the consulting firm?
Yes.
Okay.
McKinsey.
What
Are
do
you
you think?
aware what McKinsey
What do you
is?
think is a consulting firm going to sit there and puppeteer all these $1 billion corporations?
Lots of large companies
There
hire
was a
consulting
huge
firms for various
conflict of
things.
interest in there. Anyways, I just want to say, okay, that's
That didn't
funny.
land.
That's
That did
funny
not
for you.
land. I'm sorry.
Okay, listen, you're labeling me and I've been super polite and I'm not gaslighting you. Why are you gaslighting me?
I'm telling you the political realities of what's happening and where this is coming from, and I'm letting the fact that karaoke
I am against Maha. I am
don't.
against the war. I am against the war in Iran. I am against all wars.
Okay,
I am against
and
Israel.
that's great.
I am
Okay.
against. Do
Okay.
you understand me?
No,
I like
don't
science.
understand. I don't understand how someone that I think that your compassion is being used against you and you're being played like this. But I'm willing to answer your questions. You can still put your stuff in the Discord and we can talk about each of them. But I'm telling you what the reality is that this is misinformation that's being pushed, and you are
But
trying to. You're
MDCFS
looking.
is
You're using.
underfunded.
You're look at. They're exploiting your compassion for marginalized communities, and you're trying to look out for the vaccine injured, when in reality you should be looking at the marginalized people that are being misinformed and harmed and injured by vaccine misinformation. That's what your main point is, and you're not listening to that.
I'm sad about that too. I understand. I'm sad about that too. But that is why I'm asking these questions, because if we have more data about what could hurt the minority of people, maybe we can be more systematic in avoiding injuries. And I know you're not agreeing, but just listen to me just to the end of this. If we know more and we're able to prevent, well, we're going to gain more credibility again, and then people won't be as how you say that in English.
But the thing is, like,
Avoidant
none
or
of this
scared?
MadeIn, Debate Doc, we all want more information. We're pro science, or that is not what we're talking about here. What we're talking about, and the problem that the United States is having, is sowing misinformation, sowing science denial. That is what's actually happening. And I talked to all these people, these Republicans that were like, I'm not anti-vaccine. I'm just against this vaccine.
I'm not Republican.
I'm not saying that you are. You're falling on that sword yourself. Okay. I'm not saying that you are, but as my personal experience, I have been debating Republicans for 6 years on this. And they said, I'm not anti-vaccine. I'm against this vaccine. And then guess what? Now we have measles
I'm not against
outbreak.
this vaccine either.
I know,
Again.
but listen, I don't understand why you keep falling on swords and saying that you're not Republican, but then falling on these swords. Like we have vaccination rates that are plummeting in the United States that are measles, mumps, rubella. We have whooping cough outbreak that's happening right now. We have measles outbreaks going on right now. So obviously the whole point is that their whole point wasn't making the SARS-CoV-2 vaccine better. Their point was sowing discord in vaccines in general, and that's what's happening, and that's what they're doing.
Okay, so people are saying that.
And by the way, your science credibility argument is completely wrong, because Democrats and independents, science has not been discredited amongst those groups. The only group that actually has less trust in science is the Republicans in the United States. So again, there is no distrust in science amongst the United States and amongst Democrats and independents.
Listen, I love science. I read studies all the time. I might interpret it really bad because I'm not a scientist like you, and I do agree that I have a lot to learn. Okay?
Okay.
I'm just saying. Okay, so can you still agree that MECFS is wildly underfunded?
Yes.
I mean, I don't know about underfunding because I just looked it up. It was myalgic encephalomyelitis was first diagnosed, like that specific terminology. It was first used in 1956, chronic fatigue syndrome in like 1988. And there's been, a plethora of research on it since that time. And, like I was just looking through the history of it briefly. And, it's just this, like time after time, same pattern. People proposed that it was related to, because there are these outbreaks, it's related to this, condition, like, chronic EBV infection. And then somebody else debunks it. They say, oh, no, it's not chronic EBV. And then it's human T-cell leukemia virus, HTLV2, right?
It's much more complex.
And then people debunk it and they say, oh, no, it's not actually that. I don't know why you're interrupting me. And then they say, no, it's not HTLV2, right? And so it's this like, kind of merry-go-round of like throwing out this, potential etiology and then that potential etiology getting debunked and throwing out this over and over and over again, which is, again, why I said it's kind of a controversial thing. Well, I don't know if it's underfunded because it seems like there has been a lot of research into it.
Historically, the funding has been very low compared to other illnesses. So I'm sorry, but I could research it more. Maybe I'm wrong, but this is what I've learned. So,
I mean, what do you want a commensurate level of funding with? Do you want a commensurate level of funding with?
Well, I mean, if it's not researched enough, maybe we don't know enough about it yet. And if we don't still have many markers really associated with it yet, it's because research is not advanced enough on this.
Well, you're drawing this conclusion, right? You're saying we don't have definitive markers, we don't have a definitive organic cause, right?
Well,
and so no. And so in your head, and in your head, that means, oh, there's not enough research funding. We haven't done enough research. Can you think of another potential reason for there not being a definitive etiology found?
Thank you for calling me stupid. Thank you very much.
Oh my gosh.
Okay. It's a complex illness. It can be polysystemic and it can be from different causes, creating, a similar cascade of symptoms, and it doesn't mean that everybody's going to have the same markers. And it doesn't mean either.
Could it be related to something like somatic?
It also didn't mean it. It also could mean that the markers haven't been found yet, or they haven't done the studies that highlight what's really happening.
Or you still didn't say it. Or
and you think,
or it's related to something like somatic symptom disorder.
I know that you want to go. That it's a somatizing, or how you call it, psychological syndrome or something. I don't know.
How can that not be? How can that not even be on your radar of things that could possibly be it?
I'm not saying it cannot be part of the picture. Okay, it's just that this is.
You don't think that you don't think that humans are manipulatable, like through marketing?
Listen. This is what I've been doing for years now, trying to help people with the syndrome. So I know enough, and I could talk for years about it.
I don't understand. That's such a weird niche.
It doesn't matter anymore. I understand where you guys stand and that you're not open to understanding something a little bit more advanced about this because there are experiences that have not yet been studied by science, okay? So
I'm completely open to it. It sounds like you're closed off to other possibilities.
Thank you very much for the discussion that is going nowhere, clearly, and you guys are superior and smarter than me. Thank you so much for Thank you so much for
I did have
humoring
a question.
an idiotic girl.
Just let MadeIn ask a
Very
question.
nice.
Just let MadeIn ask a question.
I had just two quick questions actually. The first is what website are you using to get some of this information? But second thing I want to address is I know individuals with ME/CFS, so I don't discredit that. Okay, what I am saying is that by and large, these individuals are going to benefit more from receiving a vaccine, and it is very unlikely that it is the vaccine causing these illnesses. We have seen with the research that we do have that there is likely an immunological trigger with ME/CFS, and the immune system is so complex,
Yes.
that there really is. It is not possible in many ways to determine what or project how every single individual is going to respond, because when the immune system can not behave appropriately, that's up in the air. We don't know how that's going to look. So it's complicated in that regard. Yes, research is needed. But I think that a lot of the information that we are seeing with the vaccine misinformation is doing a disservice to the individuals with chronic illnesses, because they're not getting vaccinated, and then they're more vulnerable to infection, which is making them often progressing their ME/CFS or developing other conditions that coincide with that.
Okay, MadeIn,
yeah.
I'm not saying that all people with ME/CFS are going to suffer from the vaccine, and I've seen some benefiting from it. Is not what I'm saying. Is that for those that have reacted or report to have reacted, because of course you can suppose that it can be just anything and it's actually another infection or the actually COVID. You can say whatever you want. I listen to what people report, and I work with people that seem very smart and alert. So not everybody is, but I mean, I work with people that are smart and alert in general, and they describe their symptomatology very well, very, I don't have the words as I'm saying. I'm a French Canadian, so sorry, I don't have all the best words here. But I work with people that, suffer and tell me their story, and I'm no one to dismiss, because you know what? I have myself. And I know this is anecdotal and it should never be personal, I understand, but I cannot dismiss my own very extensive experience of being dismissed and then finding the real problems and getting better with the right cure. And I've seen this over and over. I've read hundreds and thousands of testimonials now in the last 12 years that I've been in this community, reading about all the possible causes for this illness, and there are so many. I've made quite an extensive list of things that can influence this illness, and when people remove slowly the causes and repair the terrain, they get better. Okay, so this is
terrain theory.
Science is not on board yet.
It is.
Okay.
So
theory person, you don't believe in microbiology?
Here's the thing. The reason I've been pushing back isn't because
and
I
it is
definitively
about microbiology as well. It's not.
So the reason I've been pushing back so much against you, no, dude, you just spoke for 5 minutes. The reason I've been pushing back so much is not because I out of hand dismiss ME/CFS or any of these other things. It's because you came into this conversation with a preconceived conclusion. And you weren't asking questions. You were trying to sow seeds of doubt, right? And trying to,
I want to understand,
backhandedly try to convince us.
No, I don't want to convince anybody.
These things,
I
right?
actually don't care.
So, dude, I'm coming at this with an open mind, trying to look at the evidence and be evidence guided in any conclusions I might draw, or allowing the evidence to guide me in a direction for further research. But everything that you've said has demonstrated that you firmly believe, and your mind cannot be changed, that ME/CFS is real. It's got these various multitude of organic causes. This post-COVID vaccination syndrome thing is real, and it needs to be researched further. I mean, laughably, at the beginning of that article, it said that one of the reasons for like bringing attention to this was for more compensation for the victims. They straight up said, we want these people to get paid, right? Like, that's unbelievable at the beginning of a research article. But I'm coming at this with an open mind, saying, okay, where's the evidence, and where's the evidence going to guide? Like me and my thinking and the larger scientific community. But you just told us about your firm beliefs in this stuff and how it's guided not by the science, not by the evidence, but by all of this anecdotal evidence that you've gathered over the past 12 years, in which you become further and further and further entrenched in this mindset and this belief system.
The 12 years is about reading other people's experience, but my own
it's all anecdotal. Everything you've given is anecdotal.
I'm very aware, and I said it prior to my argument that I know that it's anecdotal, and I know it. I understand.
So after you say I know it's anecdotal, why should we listen to a single other thing you say?
It doesn't mean okay, but it's still. It's not my own anecdote, and it's not one or two people. These are I've read, honestly, hundreds and even thousands of testimonials, which, and I know that if it's not validated by science, you're still going to call it anecdotal. But when do we draw the line between a simple anecdote and thousands of testimonials?
When it's investigated methodically and rigorously,
and
right?
What if it's not? We feel that it's not enough done for now. This is what
when people have randomly selected a group, right, and they've had a research question, and they have and they have a list of criteria that they're going to look for, a list of things they're going to investigate. They have some sort of intervention in mind with, planned outcomes, primary and secondary, and, well thought out meticulous methods for collecting data related to those outcomes. That's when you trust it. When you have self-selected, right, a whole population of people who purports to have, this condition and these symptoms, and they're postulating that it may be related to X, Y, or Z, and they've done these, non-methodical things to try to quote unquote cure them of this condition. And you've just eaten it all up and only looked at that and none of the contravening evidence, right? That's why it's not scientific, and that's why it shouldn't be believed.
Yep.
So if a community of people, still come with a diagnosis and a history that is similar, and they come together and they discuss, and they're all pretty much almost all dismissed or partially dismissed, or have some doctors or some microbiologists giving some insight on parts of their condition, and that we put all of this together to understand what is happening, that it still have some validity at some point, especially if a lot of people come together to get better.
No, you should go look on some of these there's some subreddits for
let's say
for various eating disorders and body dysmorphia and stuff like that. And there's some really or drug communities. I know it's not what you're talking about. This is an example. And there's some drug related communities on Reddit and stuff like that. And some of them are trying to offer legitimate evidence backed information, but some of them are these little cesspits where these people convince one another that you're right, you're not skinny enough. Here are some strategies that I've done, that I've used to make it, easier for myself to purge. Things like that. These really toxic communities where they're convincing one another of conditions they have and, things that they've tried. And
this is a very superficial comparison to what MECFS does to people. I'm sorry, I'm not gonna I'm
No,
not gonna be
I'm
that
not saying that like the conditions are related. I'm saying that like if you're looking in a community where all of these people are hyping each other
listen,
up, then it's not
you're,
surprising to me that you
listen,
may, in this particular community,
you're
find a bunch of
being,
people sharing the same stories
yeah,
and,
I
you know, very
know.
similar anecdotes.
Oh my God, that is
And
like
I'm
the
not saying that this is
ultimate.
the only explanation for it, but you're discounting it as a possible explanation. Like you're
Who
not
says it's the
approaching this
only?
methodically.
No,
That's
no,
what
no.
I'm saying.
Wait a
Not
minute.
approaching it methodically.
Wait a minute. You decided that it's the only explanation. You decided that it's the only explanation. But what I'm
I
telling
didn't.
you is that.
I explicitly said I didn't.
Oh, okay. You're not. Okay. Anyways, this really sounds to me like medical gaslighting for you to say that we're just getting together and inventing symptoms
I
so
said that's
that
a
we, I don't
possible
know.
explanation that
I'm
you are
not.
discounting.
I'm
You're
not.
discounting possible explanations, not
I'm
me.
not
It could all be.
discounting
It could all
that.
be totally
Okay.
real.
Listen, I'm not saying that maybe a subset of people are not suffering from this type of delusion. It might be, okay? It can be, but I've seen also people treat really serious, parts of the illness or factors of the illness, and then a lot of the symptoms resolved. Some people had to treat more than one. Some people had to treat several conditions till they got really better. And I've seen this, and this is not like an invention. It was not prayer. It was not like just belief. So if
So
it would
here's
be
the thing: you're
interesting,
treating
and
all of these as totally
I'm
legitimate and
not
valid,
treating. I'm
when
not
it
treating.
may be
No.
right. They may all be totally legitimate and valid, and some proportion of them may be somaticization egged on
It could
by
also
a
be. It could
community all
also
sharing
be.
similar stories. Like you don't know because it hasn't been rigorously studied. And it's all
Exactly.
anecdotal, and that's what you're basing your entire belief system off of. And that's what I am critiquing.
Okay, so for you it's all belief, but so experience is belief? Are you saying that experience is belief? I'm not religious, by the way. I'm a perfect humanist, atheist, socialist. I'm not Republican and I'm not a conservative. Even in Canada, you guys are like just, you don't understand. You label people, you put them on one side or the other, and then make like
I haven't said a single
assumptions.
label.
Honestly, it's completely useless. I'm trying to open a
You're one of the most
dialogue.
disingenuous
What
people
if,
I've heard speak.
yeah, you know what? This is why we're never going to be able to have a dialogue.
No, because
Yeah, because you can't open your
you,
mind.
yeah, it's because you've just been coddled to for too long, and you've listened to these people
Yeah, I'm
and
cuddled. I'm
coddled.
cuddled.
Yeah. You've been coddled. Yeah. And you've been allowed to and you've created this like anti-capitalist framework in your brain that these people are being exploited by the system, and you're looking out for them and their marginalized communities. And it's like, and you're not. And as MadeIn was saying, that like the people that you are actually trying to look out for are being harmed by this anti-vaccine scourge, and you're helping the people like these. Like,
I actually think that anti-vaccine is really bad. Anti-vaccine discourse is very bad. I'm
There's
not
a chronic
for it
fatigue
either.
patient in the comments who asked if they could come up. I actually would love to hear, their thoughts if you're willing to have them up.
yeah, hey, go ahead.
I can drop from if you want.
Yeah, go ahead. Hey, I hate you and Dennis. Sorry, how's it going?
I can as well.
Yeah, so I've had chronic fatigue since I was 11 years old. I got mono and I just never felt better again. And during times when my symptoms worse, right, it's just because of information like that online, right? Feeding into this community that sometimes is just telling me things that aren't true.
That's hilarious.
Why are you? So you're advocating for my community, but you're going to laugh at me?
Listen.
How are you laughing at her?
I'm
So
not
I've had chronic fatigue for what, 20 years now, and that's not enough for you?
I've had it for 40. And I got much better.
And that
I know
gives you
people
permission
that
to
get
laugh
much
at me?
better. Why do you come here why don't you ask questions about what helps people
I have.
like you? What have you done? Can I ask?
Talk to my fucking doctor. Actually read real studies that are peer reviewed and approved.
Why?
And I
Why
was
did
like
you
I was
call your
saying,
doctor-
by
Why did you call your doctor fucking doctor? Why did you say that?
I didn't call my doctor a fucking doctor.
This is what I
said
heard. I'm sorry. Is there a cut? Is there a recording of this? I'm gonna go and heard it back. Listen to it.
Why don't you believe me?
Because this is what I heard. It's okay.
No.
I can believe
Why
it.
all of a sudden now that you have someone who has chronic fatigue, who's had it since they were a very young child, why all of a sudden do you no longer believe me?
I believe you that you have it. Okay.
Why are you treating me like
what
you don't believe me?
What are your symptoms and what have you done? Can I ask?
So you
that?
don't believe me.
Well, can you tell me the symptoms that you
Why?
have and what have you done? Can you tell me?
Why?
And how does it affect you? Well, because
You're not a doctor.
Oh my God. Okay. Fine.
You're
It's
one,
just
not a doctor. You're not
mind-blowing to
my
me that,
doctor.
like, Sonia, all you care about is anecdotes and this one marginalized community, and yet you
Okay, no, I
literally
will-
have
I
an
will-
anecdote
I'm-
from
I'm
someone in that
listening, I'm
marginalized
listening.
community, and the first
But
thing
it's
that you do
because
is
you
throw
come
it out.
here-
Like, it's like, what?
You come here and you try to discredit also like my own experience as well.
No, I didn't.
Well,
What did I say that was doing that?
I saw you writing that I was hurting you like 100
You are.
times. Tell me why.
Because you're advocating for harmful things.
How do you know?
Because you said you were. Everything you described, absolutely harmful. Trying to get people to think that scientists don't pay attention to people that are vulnerable to vaccines, that's harmful. Because every
This
time you
is
get a
not what I
vaccine,
said.
no,
I
every
never
time you get
said
a vaccine,
that.
no, that is what you said. You
It's
said there
not what
wasn't
I
any
said.
research about this.
No.
That's not true. Every
That's
time you
not
get a
what I said.
vaccine, you're given this huge sheet, right, of paper with information about who could be vulnerable, right? And I was given extensive information about who could be vulnerable because I am a vulnerable person.
Well, honestly, here in Canada, I didn't see that. So this is maybe why I'm asking questions. I didn't see
because
people
you didn't
receiving
see it,
all
it
of
means
this
it didn't
here.
happen?
Maybe that made a difference.
Because you didn't see it, it didn't happen.
I don't know. I'm not saying it's not happening, but like I'm asking questions because I didn't see these papers here.
Well,
So maybe
this is
you
like a
guys
standard thing
did a
across the
different
globe,
type of
where when you
campaign.
get some medicine, you get your medicine and there's a huge piece of paper
Well,
that
good
has
for you.
all the risks
Okay.
laid out on it.
Okay.
I've-
Okay.
She's
Thank
just
you so
describing a
much,
vaccine
Kristen.
insert. Like that's
it's
standard.
a vaccine insert. You get vaccine inserts. You get medical inserts. You get all of this information. All of this information is available to
Okay.
you before
All right.
you even go to the pharmacy to get your
Okay.
medication or get your vaccine. All of this information is available online.
It's
right.
great.
You can look it up
I
from
know.
World Health Organization.
You're
You
right.
can look it up from multiple different sources. If you don't trust the
my
Canadian
God.
government, you can go look up different governments. All of this information is available to you. You just sometimes have to do a little work
Okay,
to find
so
it or figure out how to
listen.
sign up for mailing lists to get that
Listen,
information.
I have
but
to
as a
go to
vulnerable
work. I
person,
don't
I've
have
spent
all
20
of my
years of my
time.
life learning to do that.
Okay, so if my experience is anecdotal, yours is as well. Okay.
Well, then,
And you
so
are
is
not. I'm
everything
not the
you've ever
measure.
learned for the
Hey,
last
I'm
20
not the
years.
measure of the whole community, and you aren't either.
No, there's no whole community.
Okay. It's not a sect. It's not a religion. I'm talking about not representative of all
Your
the
anecdotes,
NDSEG.
any anecdote you ever read, I don't care. Doesn't matter to me.
There is one more thing I would like to say, and I mean this genuinely, Sonny. There is one way that by putting like all of your, I guess, like eggs in one basket about vaccine harm, essentially in regard with like MECFS. My apologies. What can wind up happening is individuals may then become so convinced that it was the vaccine that they eliminate possible treatment options for themselves. So we're seeing
I don't advocate for that at all. So like
What
you not tell
what
me
I'm
What you've
saying-
that's
said
not what I do.
has.
Hold
That's
on
not what I
one
do
second.
ever.
What I'm saying is that with a lot of people with long COVID, for example, that have a lot of overlapping features with MECFS, they're doing a lot of trials with antivirals. Well, if an individual thinks that they were vaccine injured, why would they ever think that they would need to try an antiviral? And if they're not trying an antiviral, they're not going to improve because they're blaming something that's not the culprit.
Exactly.
Well, all I know is that here where I live, to get help, even for just long COVID, let's say it was never caused by any vaccine or whatever, it's very hard to get help here where I live. Okay, so
Yes, long COVID clinics are generally
sucks.
like full.
It's awful.
and it's actually even worse here in Canada, by the way, much worse.
MadeIn, by the way, is honestly one of the strongest advocates for SARS-CoV-2 COVID-19 that I've seen on this entire app. MadeIn, the person that you're talking to right now, talking about papers on long COVID, talking like she more so than seriously anyone on this app, like championing this issue. So like she's on the forefront of all this research, and she cares a ton about this stuff.
So much, because it's genuinely like repeated infections are going to cause harm, and I want people to be aware of that, because I think it's been not downplayed a little, but I think the focus has been so much on the acute phase of the illness that we've lost sight of what can happen in the long term, the long-term effects of these infections that we've now decided, since it's endemic, that we're going to continue receiving once, twice a year. I think the last one I saw is that on average, Americans have been infected at least 5 times on average, and this is just in the 6 years, So, and we see that with each infection, you increase the risk of developing long COVID. So I think that this is a big deal, and I think it really needs a lot more consideration. And vaccines is a really good and helpful way to help at least reduce viral load to prevent some of the chance of developing long COVID. It's shown to be protective. We've seen studies. What was his name? Dr. Ali Oh, I have it. It was the mouse models where they showed that the vaccine had protective benefit with reducing the amount of spike protein accumulation in the brain. The vaccine
That's real science.
It was an amazing paper.
MadeIn up until okay, so 90%
Just dropped
of
a
what
follow
you
from
said,
him, by the way.
I was like
follow.
completely
Thank you.
agreeing. I was completely agreeing with like 90% of what you said. I have observed, and I am nobody. I will agree, and I will say humbly that I am nobody, but I have observed, even through all the people that I've talked to, and I talked to a lot of people, which is of course nothing compared to any study, and I know that. I have observed that the more the people do have repeated infections, the worse they get. I'm talking about
Well, and science agrees with that, but the problem is that you're uplifting these anecdotes that you've received from people, right? That clearly have stories that embolden your viewpoint.
Exactly. And
right?
the fake
Because
stories, like it's so ideological. Like the VAERS database, like has a bunch of like fake stuff in there. Like where like my favorite VAERS entry personally is the one where the guy talked about how his vaccine harm was that his third leg grew 3 feet and now it's dragging on the floor. That was in the VAERS database as an official entry. So like a lot of times like people go through there and they see all these junk entries and then they read this stuff and then they think that they're legitimate anecdotes, but they don't realize that like an actual researcher has to scrub those databases. You can't just take an anecdotal like as a piece of evidence. You have to match it with an actual health outcome, with actual medical resource and actual like data, that they can link together. Just the anecdote isn't enough. It isn't enough.
No, but these are
but you come up here and you say, instead of "I don't know about this," you say stuff like "scientists don't care about people." You say doctors. No, please let me finish.
Not what I said.
That is what you said. You said scientists don't care about these outliers. They don't. Don't interrupt me.
I didn't say scientists.
I was here the whole time you were here.
But I was talking about.
Are you gaslighting me now?
Methods. I'm talking about the method of shrinkage.
Yeah, that's literally what I'm talking about. I don't know why you interrupt me to gaslight me about that.
I was asking questions about it.
No, you weren't.
Oh my God.
You had an actual MD that's done research that was talking that exact thing like through, and you still are bringing it up. Like what more do you need? I've never actually done any human trials before, but you had someone that actually had an MD that's doing that. I mean,
When you talk about these things as if you come from a place of authority instead of please don't interrupt me.
In the beginning that I was not, and that I'm not a scientist. I said it in the beginning.
Please don't interrupt me. You talk about these things, saying these broad statements, right, about the methodology and all of this stuff, when you, admittedly, you yourself are not a scientist. When you do that, you embolden people who wish to further harm disabled people, vulnerable people, by drawing to question these things that you don't fully understand. Instead of just asking questions, you've made a lot of, oh my God.
But you're saying a lot of false things in what you're saying.
You can't even let me finish a sentence. This isn't an attack to you. I don't know why you think it is. It's not. But if you really care about this community, then you need to listen to people in it. Because not only do I have chronic fatigue, I have like 6 other rare disorders that don't get nearly as much research as chronic fatigue does. So like I'm someone who is absolutely affected by this. So by you calling into question these things and claiming these things that aren't true, instead of just being willing to listen to 3 people who are highly qualified to talk about this. Like, look, you can even see literally all his degrees back there. Highly qualified to talk about this. When you don't know something, instead of making claims about something, why not just say, hey, I'm not sure about this, instead of fighting back them the entire time? Because that fighting back does things that actively harm multiple communities you claim to care about.
Like Sonia, I mean, you will agree with me that there is a huge anti-vax problem in Canada, right? That measles is like a huge problem that's happening that we need to help people get. Okay, so let's work on messaging on how we can, bolster, the scientific, credibility, I guess. If you said that before, I don't necessarily agree, but like I don't know what the problem is in Canada that's causing the anti-vax, it's sentiment that's happening there.
It's actually stemming from what's happening in the USA, by the way.
Okay, so it's misinformation that's pushed by bots and stuff like that. Is that what you mean?
I'm serious about it. A lot of people in Canada are Trumpists and MAGAs and MAHAs, and it breaks my heart like you cannot believe.
Okay.
Yeah, but
perfect.
by engaging in things like,
you know what I mean?
By engaging in things like terrain theory, right? That's not real. That's misinformation. That You're also spreading that misinformation. Yeah, and that is specifically a Maha thing that was born out of Southern California, the Bay Area.
Yes. Do you think terrain? So you think terrain theory?
It's not all. No, it's just.
You know what miasma theory is?
Isn't that kind of the same thing? I don't know.
When did miasma theory come about?
Listen, I told you that I want to know. French Canadian. Please, we don't have the same words, so maybe
this isn't even from the United States.
I will tell you if I understand what it means.
This was like pre-Black Plague.
Okay, so let's terrain theory is pushed by people that don't believe in germ theory. They basically think that microbes aren't real.
Yes, it is.
That they don't think that viruses are real.
No, I understand now. It's okay. No, I'm sorry. So then I really didn't use the term well. I absolutely believe in germs.
Okay.
I actually think that it's quite the core problem.
Okay.
I believe in
so
germs.
I mean, so basically,
I actually believe it's the problem in almost all illnesses. Of course, there are structural issues. There are many things, but I do believe in all the germs. No, don't worry about that.
Okay, so
then you need to be more careful about what you say.
Yeah, I'm giving you a context.
I told you guys that I'm French Canadian, and so sometimes
your English is fine, but I'm just letting you know. So basically, instead of germs, they think that terrain or the environment causes the disease. So instead of someone getting sick by a virus, they think that they're just they're creating the environment inside of their body that degrades, and that's where the disease comes from, as opposed to viruses causing disease within people. So that's what people talk about when they say terrain theory.
Okay, I didn't.
That's okay.
Sorry.
I understand.
Sorry, it's okay. No, I absolutely believe in germs, and they can actually, if there's something about it, I do actually believe that they can modify the terrain, if that is what the terrain is.
Yeah, it's basically they pushed by these Maha people because they're trying to sell supplements, and they're saying, well, if you want your terrain to be healthy, then you need to buy my $100 a month
I'm not in
vitamin
that
pill.
world. I'm not about
that's
that.
fine. But I'm just saying. But see how like
I'm
Sonia,
sorry. Well,
Sonia,
thank you
Sonia,
for correcting me, though.
Yeah.
Do you see how
no
I'm
problem.
open to be corrected?
And you're welcome back, and you're welcome here anytime. And I'm not like that's totally fine. But I'm just saying that like this is I think
you so
that
much
genuinely
for correcting that.
Yeah, genuinely, like we have to help science be more credible. We have to like help people come back from these crazed, like the states.
I want to actually create a dialogue. This is why I'm trying to understand things better.
Good.
I'm serious, and I know I might come across like somebody who's not believing science or not, but this is not who I am, and I'm not as knowledgeable as you. So like, I'm very ready to absorb what you're saying. Okay.
I just think it's important to become more knowledgeable before you have these conversations.
It's a lot of times the people's like first chance to like ask a scientist a question. So this is they're basically saying things that they had just like heard before. So that is like what happens.
Yeah, but if you're going to claim to advocate for people, you should be an expert on what you're talking about.
Yeah.
Because a lot of what you're saying is
a normal human being that is talking with many people and then trying to understand things.
But that's great.
Listen, there are many.
Don't call yourself an advocate.
Hey, I'm not. I'm coming here to understand things. Okay.
Well, if you would let me finish my sentence.
Then
you would have understood that I was going to say is that you're towing a line in between like reality and very dangerous misinformation that is causing people to unalive and perish.
Yeah.
Right.
Yeah. And I think like the problem is like Sonia, a lot of the words that you have talked about and the phrases that you put in, if you put it into Google, you're going to be going into some Maha blogs. You're going to be going into like a lot of places that say they have studies that they say they have this stuff. So that's why like someone like me who talks to these Republicans all the time, and I'm like, oh, I'm recognizing these red flags one after another. I'm not calling you a Republican, right? But I'm saying that you're lighting up all these flags and stuff that I'm like, okay, this person is just unintentionally picking up right-wing propaganda. That's just what I'm saying. And I'm not saying that you are, and I'm saying that should, as a fellow leftist, I'm telling you that your compassion is being taken over. You know what I mean? Like they're exploiting you in a bad way.
Dr. Greg, can I tell you something about this? You referring constant to Maha and Trump and whatever.
Sure.
I've been navigating this since well before this movement of Maha was born. Okay, so please stop. I'm not a Republican. I'm not Maha. I'm not MAGA. I am extremely distraught from this political atmosphere going on all over the world. I'm actually not well about it at all. Okay. And I understand why you think I'm manipulated, and it's fine. You can think that. I know my experience, and if I could talk about it for a long time, maybe we'd come to. I don't want to convince you, and I know you maybe want to convince me. I don't know what we're doing, but we're conversing, and I think that I have the right to ask questions to understand better.
Always.
And if isn't this democracy to be able to talk? 'Cause, like, my goal is really not to win.
And here's the thing, no one is saying that's your goal. No one's calling you a Republican. No one's calling you Maha.
Well, in the beginning, yes. I was called.
No one here has ever said that, not even once. What they're saying is you need to be careful about the information you're absorbing and talking about, because it harms people, harms communities, harms yourself.
Mm-hmm.
That's all anyone said the whole time.
Yeah, and I am
Okay,
trying to. We are trying to fix this problem that we need to solve, which is this anti-vaccine, problem, right? Where people aren't vaccinating their kids. I think that it's child abuse. I think that people are harming their children by not vaccinating them. I think that we have been way too soft and coddled these anti-vaccine sentiments and stuff. So that's my thing. I feel like we have to give these people some tough love. So that's my angle that I'm coming at it with. And we politically are an active community that are trying to stop these Maha bills. We've done over 1,200 political actions, calls, emails, trying to stop over 400 anti-vaccine, anti-public health bills that are in the United States. So I'm not neutral here. Absolutely, I'm trying to fight against this anti-vaccine stuff, and we're a whole community of engaged people that are trying to actually make a difference. So,
Okay, I'm just trying to understand. Okay, how we can establish a dialogue, because my impression, and I can be wrong, is that there are people that maybe it was just an impression, but there are people that at least think or are convinced that they've been harmed. And I'm not saying that the cause was necessarily the vaccine. It could have been their previous condition or maybe some genetic predisposition. And again, I can be wrong, and you can judge me for being ignorant. You can, absolutely. I'm just trying to understand how we can establish a dialogue so that these people that have been convinced to be injured and that sometimes are also dismissed by the medical community, the system, especially here, there's not much help in Quebec and in Canada. And actually, Quebec is even worse than the rest of Canada. And I know that there are a lot of people with chronic illness and autoimmune disease, especially women here. And I'm saying maybe it's not the case in the US, but what I'm saying is that we're seeing this a lot. People have been dismissed. And when they're dismissed, they cry, they scream. And the more they scream, the more they scare people around them. And the more people are scared around them, well, the more it becomes a paranoia that is not justified. What if there was more studies about what is really happening so that we know better how to prevent these injuries, even if they're extremely rare? What if we know more? And I know there's maybe some studies, but I don't think it's all done. And maybe I'm wrong again.
I think-
You can correct me. And then what if knowing better and preventing better will appease the population and create more trust?
So I think of course, more studies is great, but there's this assumption that the world of science doesn't care about these people.
This is not what I'm saying.
Like, you're saying that
you know
these
how
studies aren't
studies-
being done.
Are you yourself a
the world of
scientist?
science isn't considering these people. They aren't making great strides to help these people. And if they did, right, then people would trust science more. Science is doing these things, right?
Some are doing it, but then it doesn't necessarily in the medical system. Maybe there's a lack of communication. Maybe something is
So,
happening because there are.
Do you want to know
people
what's
that
happening? It's
feel
political.
harmed.
There's
It's all
also another,
politics.
if I could say something quickly, there's also, we can have all kinds of research, but another major issue is a lack of understanding and education on fundamentals about how the immune system even works. For example, the immune system is incredibly diverse, like as our species, and that makes a lot of sense because if we all had the exact same functioning immune system and we came across a pathogen that we are all vulnerable to, that would wipe out our entire species. So we have to have a lot of variance in our immune system and how it responds to different microbes, different viruses, different bacteria, you name it, right? And so then because of that diversity, we cannot predict how every single individual is going to respond because that's how our species is able to survive because it's going to respond differently. Does that so that's why we don't understand some of the stuff because we just can't. We can't predict how every single immune system will function because of the diversity.
I understand that. But the problem is that that will cause maybe a very minor percentage of people to suffer. And the problem is that those that do, and I know that a lot of you don't believe this, but I don't have the luxury of not believing, because I listen to people and I don't like to dismiss people. And you can say that I'm manipulated as much as you want, but this is who I am. I listen. Maybe I have too much empathy, maybe not. But I listen. Before I listen, and I draw a conclusion. I still ask an incredible amount of questions, and what I see is that, and again, I even know that correlation is not causation, okay? I even know that, and I try to apply that principle a lot. But what I'm saying is, if we knew more, or if things would be studied more on these things that you're saying that we cannot understand exactly all the individualities, but what if there were a little bit more studies on this? Like, do you think that there could be a little more?
What is the perfect amount of studies?
Yeah, how many studies do you
I don't
need?
know.
I mean, I don't think that it's amount of studies problem. It's the fact that people understand the world and they perceive scientific things that are happening through these algorithms, and people see things at one title at a time, and they see thousands of different, they have a page full of conspiracies because they're interested in conspiracies, and then they have these algorithms that push like vaccine harm stories one after another to them. So that's all they see, and they live in a world of, the world is flat and the vaccines harm people, and now they think that. So it doesn't matter, in my opinion. It actually doesn't matter how many studies that we do, because we have these algorithms that are shaping how people view reality, and it's harming people.
So I have a question for you. You know more about this than I do, okay? And after, I'm gonna have to leave because I already am late for my tasks.
Sorry.
And again, I'm sorry. I know I'm monopolizing a lot of the panel.
No, you're
and
great. It's awesome.
Really,
I appreciate you.
I'm actually appreciating this so much, because you know why? Because the smarter I get about this, I'm not saying that I'm smart. The more knowledgeable I am about this, the more maybe I'll be able to create a dialogue between people that do you understand where I'm going?
Sure, yeah.
Okay.
You'll be a better patient advocate. I can get that. Like, the more educated you are, you can advocate better.
Yes. Okay.
You had a question. I was talking about the algorithms fixing people's reality.
Okay. Okay. So, first of all, I don't believe in flat Earth either.
Yeah.
I really don't. You know what? I'm gonna have to leave, so I feel that if I start this argument, it's gonna be a long time. What if I come back?
Okay, you're always welcome back.
When are you? Because also I feel like I'm monopolizing a lot. And when are you doing these?
I usually go like 9 o'clock PST. So that's usually like when I'm usually a nighttime streamer. But I've been doing more of these during the day. Yeah, 9 o'clock Pacific at night. So it's usually like a nighttime stream. But you're welcome to join the Discord, and absolutely. So yeah.
People think that you see these comments. I'm here to discuss with scientists. If I thought science was bad, I would never come here and have myself, anyways, I feel like I'm not understood. I actually want to understand science better, how it works, how you guys think, how it's done. I want to know more about how to understand studies, how to how to even judge if they're positive and negative, or if they're credible or less. I want to know more about all that, actually. I really want to. So, okay. And I also want to tell that, oh, shoot, she left.
But she's still here.
Okay, I just wanted to express that I actually do have compassion that I hear that person that was talking about. I have suffered like more than half a dozen complications, and I actually even have a very serious, very complex and rare disease myself. Okay, and I've done everything under the sun to get better. I have found solutions that, when you look deep down, the science is there, but it was not transmitted to me by doctors. It was, I understood it through reading a lot of actually science. Honestly, I read a lot of studies that doctor never mentioned to me, and that actually helped me get better. I found solutions myself. So, people that tell me that I don't like science, that kind of, I resent that.
Okay.
And
We'll have to
see you
unpack this
laughing
later.
at me.
We're gonna have to unpack that later. We're gonna have to come back. Okay.
But it's serious. It's serious.
No,
okay?
it is. Yeah, it is. But yeah, it's.
You're laughing because
No.
you think that one study cannot help a person, that you have to
No,
have 100
it's because what Debate Doc was talking
to
about.
help somebody.
You can
what?
find it. You can basically find a study that says it's a study that's from a DOI that's in a journal that to say anything. So it kind of, the fact that you said you found a study to say it, you might have been.
No, not only one. I've read many studies. By the way, I've spent like 24/7 sometimes for months to find whatever could help me get better. Okay. And so I don't like it when this experience of mine is dismissed, even if it's anecdotal. For you guys, for people to say that I don't care about science, it saved my life. Okay.
Roger.
So, anyways, it saved my life, and I wouldn't be here if I didn't appreciate it, and if I want to establish a dialogue. What if I can help? Maybe I can't, but that's not my goal. It's not my goal to hurt at all, and I'm sorry if I did sound like that in any way.
It's okay. It's all good. Yeah, we'll have to tell. Yeah, you're welcome back anytime. Thank you for being here. I really appreciate you, and sorry for making you late.
Okay, no problem. Okay, thank you.
All right, thank you. Bye.
Also, thanks for having me up.
Yeah.
I
Guys,
just wanted to
follow MadeIn. Follow MadeIn right here. Follow her. She has great content, like real, genuinely, really good science content. She is constantly talking about awesome, cool things about the ongoing pandemic that happens right now. Like, guys, we're in a pandemic. So absolutely,
well,
she's
thank
awesome.
you.
And Debate Doc's the 2025 guest of the year. Yeah.
Absolutely. And if obviously you're in this live, you should be following Dr. Greg. And if not, what are you doing? You need to do that.
Something like that, for sure. All right. Thank you. Thank you guys for coming up. I appreciate you.
Hey, Dr. Greg.
I appreciate you having me.
See ya.